Hello, my name is Roxanne Fisher. I wanted to discuss the policy issue of the need for trauma-informed care for young children, adolescents, and teenagers. This is something that I am very passionate about. I am currently in pediatric healthcare, so I see the need on a day-to-day basis of trauma-informed care needing to be reached to a broader spectrum of children, as well as teenagers and young adults. So that's the policy topic that I have chosen to cover. And for the purpose of this assignment, we will be looking at some statistical data, some background data regarding trauma-informed care, and then the oppositional position of this as well. So just to point out my visual aid for this assignment, I put this together. So this is my visual aid. Sorry, I got my Halloween decorations reflecting off of it. So this represents the policymakers that we currently have in Congress. You can see here just, the greediness that policymakers have when it comes to funding. And I just thought that that was a really good representation, of policymakers, Congress, and their need for this. And then this is a visual here of what childhood trauma actually looks like. So, here he is really sad and missing his family. And this is just one example of what trauma might look like for a child. So when we're talking about the prevalence of trauma, according to Monique Tello, she found from the CDC that there's statistics on the abuse and violence in the United States that children have experienced, and they're really quite staggering. So basically, 1 in 4 children experience some sort of maltreatment. So that's some sort of abuse that they've experienced on a physical, sexual, or emotional level, psychological as well. 1 in 4 women have experienced domestic violence. 1 in 5 women, while 1 in 71 men have experienced rape at some point in their lives, which is just mind-boggling to me. And of those women and men that have experienced rape in their lifetime, 12% of the women, 30% of the men say that they were younger than the age of 10, which is really quite alarming. So that means that there are a very large number of people who have experienced serious trauma at some point in their lives. According to another study that was done by Jessica Bartlett, April Wilson, Kristen Anderson, and Zika Reed, we need to realize 4 things when it comes to the need for trauma-informed care, which is realizing, first of all, the widespread impact that trauma has and the potential paths to recovery that there are needed to be taken for children who experience trauma. Another one is to recognize the signs and symptoms of trauma, which is our due diligence as a social worker to be able to recognize the signs and symptoms of trauma, and then to be able to fully integrate knowledge about trauma into policies, procedures, and practices while seeking to actively, seek those treatment options for the children without re-traumatizing, which can be really challenging to do. Another reference that I'm going to use for the purpose of this assignment is Scott Richardson made a really good point about trauma-informed care, which is that he says that adopting a trauma-informed care approach also allows social workers to think differently about their potentially traumatized clients by asking what happened to you instead of what is wrong with you, which is really important about how it's phrased. So this is a far more engaging, respectful approach when you're working with individuals and clients that have experienced some sort of trauma in their lives. He also mentions that there is a trauma-informed care view, which can also represent as a paradigm shift, which we talk about a great deal in social work, which is basically this idea that social workers, help this idea of setting passion, caring, empathy in the profession to be able to help those that are experiencing trauma overcome what they have experienced in their lives while looking at their past in a healthy way without re-traumatizing. Another reference that I want to use for this assignment is Andy Hoochman. He's got this idea about a newly formed campaign for trauma-informed policy practice, which is known as the CTIPP. It basically states that congressional briefings need to happen to expose legislatures and their staff to the science and adversity of trauma-informed care practice, especially in regards to social work. So what does that mean? So trauma preventative policies could be implemented to reduce things like gun violence. This is his example. To also strengthen economic support for families that are living in poverty. Another one of his examples. He also goes on to talk about the need for trauma-informed policies, which is asking legislature to have better regulations for their agendas when it comes to funding regarding trauma-informed care. Another example that Andy gives is trauma-specific policies need to be implemented as soon as possible to promote better access to interventions and services that will reduce trauma, promote resilience, create more resilience, better mental health screenings, and then, of course, services that are provided to those who have experienced trauma within the greater community in which you are serving. So when you look at this on an oppositional standpoint, the big issue is obviously funding. And when you think of policymakers and Congress, there's always this debate of there's not enough money, there's this need for more money, and they're not going to be able to put the money that needs to be implemented for these changes to be made. So another reference that I got for this assignment is Dr. Bruce Levine. He's really interesting. It's his approach to why we need trauma-informed care and why it might not work is really interesting. But anyways, so he mentions that he talks about in his article, he refers to our society as not being a sane society. These are his words. But he mentions that we don't live in a sane society because our society currently prioritizes for-profit for large corporations and power for large corporations. So we put all of our time, money, energy, resources into the big corporations and things that aren't necessarily as important. But then you look at now where we are, which is almost 2 decades after the ACE study was established. And he is finally saying that, policymakers are now more than ever realizing this need for trauma-informed care. But, when are we going to get Congress to make this move? So he goes on in his article to basically talk about his response to Congress is to create more legislature that would increase funding to provide these trauma-informed care services, to provide more education in schools regarding trauma-informed care, and through parenting classes we can provide trauma-informed care. There's also a way to, provide resources to the community as a whole. So that was his whole idea. But again, the biggest opposition we have here is Congress and getting the right funding. Because while there is such a great need for trauma-informed care, we see it every single day in the social work profession, in the medical profession. It's a matter of getting our lawmakers, our policymakers, and our legislature, our Congress people in Congress to better delegate and better fund these programs for trauma to be able to have trauma-informed care. So that's where I stand with this assignment. Thank you so much for your time. Good luck with your studies.